subject pathology and topic is role of physiotherapist in chronic GI disorders. What are chronic GI disorders? Chronic gastrointestinal disorders are long-lasting conditions affecting the digestive tract. They often involve inflammation, altered motility, or structural changes, and significantly impact quality of life. In inflammatory, IBD, Crohn's disease, ulcerative colitis. In functional, IBS, functional dyspepsia, gastroparesis. In motility, chronic constipation, and in structural, hernia, adhesions, post-surgical gastrointestinal disease. How physiotherapists treat GI patients? Assessment, manual therapy, therapeutic exercise, pelvic floor rehabilitation. In assessment and evaluation, posture, breathing patterns, pelvic floor tone, and abdominal palpation to identify dysfunctions. In manual therapy, visceral mobilization, myofascial release, and soft tissue technique to reduce adhesions and improve motility. In therapeutic exercise, core stabilization, diaphragmatic breathing, and gentle mobility exercise tailored the patient. And in pelvic floor rehabilitation, biofeedback and targeted exercise for bowel incontinence, constipation, and pelvic therapy works for GI disorders like visceral mobilization, release tension in abdominal organ and fascia like this. And then neuromuscular re-education, restore gut-brain axis communication and mobility like this. Neuromuscular re-education, restore gut-brain axis communication and mobility. Breathing and core integration, reduce abdominal pressure like this. Breathing and core integration. And pelvic floor training, correct dysfunction in defecation and continence. A holistic body central approach. Physiotherapy for GI disorders does not treat symptoms in isolation. It addresses the neuromuscular, mechanical, and behavioral contributors to digestive dysfunction, restoring the body's natural ability to function. The gut-brain axis is central to this approach. Physiotherapy helps regulate autonomic nervous system activity and directly influence GI. Now we are going for the benefits of physiotherapy in GI disorders. Pain reduction. Manual therapy and exercise reduce chronic abdominal and pelvic pain without medicine. Improve motility. Visceral technique stimulate peristalsis and relieve bloating, constipation, and gas. Quality of life. Patient improved sleep, mood, and daily function alongside physical gains. And then pelvic floor function. Targeted rehab store bowel control and reducing staining during these defects. We are going for the limitations and considerations. When physiotherapy may not be suitable: acute flare-ups, post-surgical restrictions, variable response, time and commitment. In acute flare-ups, manual therapy is contraindicated during active IBD inflammation or acute GI bleeding. In post-surgical restriction, recent abdominal surgery requires clearance and modified protocols. In variable response, outcomes differ by diagnosis, severity, and patient adherence, not a guaranteed cure. Time and commitment requires consistent sessions over weeks. Patient compliance is critical. Recovery timeline: what to expect? Week 1 to 2. Assessment, education, and gentle breathing exercise introduced. From week 3 to 6, manual therapy begins. Early improvements in pain and bloating often noted. From week 6 to 12, pelvic floor rehab and core integration, measurable function gains. From 3 to 6 months, consolidation phase, maintenance exercise and long-term self-management plan. Important is chronic GI disorders are managed, not cured. Physiotherapy aims to reduce symptoms, improve function, and enhance quality of life over the. Now we are going for the conclusion. Physiotherapy is a powerful non-invasive adjunct in the management of chronic GI disorder by addressing them mechanical, neuromuscular, and behavioral roots of dysfunction. It offers patients a path towards reduced pain, improve digestion and restored confidence in their bodies. That's all. Thank you.